professionals, or students. So they kind of work with all the immigrants, and according to what we have in the record, there are about over 69,000. This number is not accurate, but hopefully very soon we might have an accurate number. So the number of immigrants actually is growing in the county, and it has been changing. The demographic in the county has been changing drastically, and this is what the county is trying to contain and work with through many different programs and offering different services. And because of that, the county has been able to, as I mentioned earlier on, contract a lot of programs, services through non-profit organizations or other organizations so that they are able to reach all the immigrant and international groups within the county as the number is growing. I know that has slowed down a little bit at the beginning, since towards the end of last year, and up to now, that has slowed down. But again, there is a lot of secondary immigration, people moving from other cities to Pittsburgh because Pittsburgh is, cheap and maybe better than other places so far. At the African community level, we have between 5,000 to 7,000 African immigrants here in Pittsburgh, and of course that include refugees, include students, include all other immigrant groups, African immigrant groups. And of course, most of these groups, what we have been seeing for the past 10 years, most of them, of course, have a lot of medical issues, especially those who come as refugees. They have a lot, some of them do have trauma, some of them do have a lot of medical issues. It depends where they come from. And then, of course, those who came here in one way or the other, of course, working 2 or 3 jobs to support family and extended family members back home, really give them a lot of pressure. So we see a lot of depression within the community members. We see also some signs of stress that is very, very common within the community members. And that is, of course, with the medical, with Pittsburgh being very medically equipped, we have been working with many different organizations, particularly UPMC, and now we have Allegheny Health Network helping the communities to overcome some of those medical issues.
All right. Thank you very much, everybody. So to the last point you just touched on there, so what we're trying to do, at least in the healthcare field, now that, especially I know from the Center for Inclusion Health, we understand that patient care goes far beyond the doctor's office. And that's part of this session here, is to make sure the healthcare providers can meet you guys and the organization that you work for, because very, very frequently, I even get those phone calls, emails of people who want to be connected to social services. I probably emailed every one of you here asking the question how to connect somebody who's been seen in the office by the doctor. So, and I know all of you have mentioned something about the health issues, but are there some particular health issues that you think or you see are more prevalent in your communities? Like, I know you already mentioned it, but if there are any others that you want to mention briefly.
I could say high blood pressure and diabetes.
Just like what was mentioned. What about you, Vivian?
I will say mental health.
Mm-hmm.
This is something that we have been seeing in our community, and this is due to the situation that families are living in. Most of the population is how they move to the U.S.
Mm-hmm.
So mental health is something that we're really concerned about the population.
Okay. What about Wasi? Anything else? I know you talked about it more.
Yeah, aside from what I mentioned, probably the thing that I've been surprised to see, so mental health is definitely a taboo amongst most of the cultures that attend, so it's difficult if you don't have anybody who admits to receiving help for mental health issues, and anybody else who even works within those fields, right? That's actually really important as well. We don't have that many people going into that, so that's also a problem. But especially amongst our youth populations, that's really probably the worst things that we see. The pressures, which a lot of them are from immigrant background, so like we're the only major religious group that doesn't have a majority ethnic group, right? So the plurality of it, you know, like essentially between South Asian, Arab, and the Black community, those are like the three largest ethnic subgroups, right? And for different reasons, they're all under a lot of stress, right? You know, some families may have a lot of stress because their children are the first generation, and there's a lot of pressure from parents, and then you go to school, and there's all anti-Muslim bullying and everything like that. Obviously, the Black community has American-specific issues that they deal with, along with Islamophobia that they have to deal with, along with whatever family pressures that they have to deal with. So there's so many different pressures that are on the youth, and then they're different for these different groups, but seeing them all interact at the center, we see it as a serious issue that they don't necessarily always feel comfortable having this conversation with their parents, and then seeking help, and then the counselors at school and teachers are not exactly as like culturally competent enough to have a conversation at times, right? So then that means that they do not have if they don't have a strong connection to our center, or individuals, which is a lot of the community, may not feel comfortable coming up here, then they're just alone in a lot of these things, and issues then compound and things get worse. So probably youth related is probably the worst thing that we see.
All right, thank you very much. So Vivian, I have a question just for you for now. As far as the immigrant that you work with, especially the undocumented immigrant, and connect that to the trauma and mental health with the current situation, do you see that getting worse, or is there specific challenges that you think people meet because of their status?
I just have about 8 months of being working here in Pittsburgh with this population, but I'm really concerned about it because we have children that they have trauma because the domestic violence between their parents, because the way they cross the border, sexual abuse, different cases that I've been seeing. And we also have youth in the same situation. And I've been dealing with many cases with women, for example. This is most in the undocumented people. They're living in situation with their, husband or their partner that there is a lot of abuse. And women, they don't say nothing because they're fears. They're living with the fears that because they don't have document, they will be deported. So they're dealing. I just moved like 18 months ago, and I'm still processing myself. Just to have the experience to move from one country to another country. And I came here in a flight, good situations. But when you're putting your life under risk, when you're just crossing a border, and you are here living day by day, thinking that you are undocumented, you're dealing with, the trauma of moving to another world and being navigated with a different system, different language, but also you're living day by day with the fear that you can be deported. So we have many cases in the Senate. There are like normal health issues, like immunization that they need, the kids need to go to school, and different chronic health issues. But this topic in general, because they don't have access to health insurance, so the cover for them is low. So I have seen many kids in our center and youth with different traumas. And we're really looking for support for this kind of illness.
Okay, thank you very much, Vivian. The last question I have for you guys, again, if we can go over these as quick as we can, what are the barriers that you see that prevent the people that you work with from accessing care? We can start with you, Benedict.
Yeah, one of the things we see within the communities is the language barrier. It's one of the most important, it's one of the first ones. And then not only the language, with the language comes the cultural piece. Like when you look at the mental piece, in some of our cultures, we don't even have that in our dictionaries at all. So no one even talk about it. So cultural barrier is really a big problem. And then we have, coupled with that is the domestic violence. We come from culturally, most of our communities come from a cultural background, and now coming here to the U.S., differences in the culture, and the way how things are really cause a lot of families to be dysfunctional and cause a lot of separation.
Thank you very much, Benedict. So again, the same question for you guys, but if we can go ahead and wrap up as soon as we can to be able to give the audience time to ask questions.
What we have observed is the people who doesn't have document, they can have health insurance, so they can, access to the system. The knowledge about how to navigate into the system and the language barriers. Transportation issues. This is most in communities far away of the city.